Hello, wonderful and back Dr. Talia Amara. It's truly a pleasure to connect with you all again, especially those of you joining us from across the beautiful states of America. As many of you know, I've spent decades in the medical field, and during that time I've noticed something quite profound. So much of what we believe about our health, especially men's health, is simply not true. And it's not your fault. Information can be confusing, and frankly, some of it is downright harmful. Today, I want to talk about something incredibly important, something often whispered about but rarely discussed openly and accurately: men's health. We're going to tackle 5 of the biggest myths that have been floating around for generations, myths that might actually be causing more harm than good. My aim is to shed light on these misconceptions, offering you the kind of straightforward, honest advice you deserve, just as I would offer it to any patient sitting in my office. Now, before we dive in, let me just say this isn't about judgment, it's about empowerment. It's about giving you the correct information so you can make informed decisions about your own well-being. So, let's get started. Myth number 1, bigger is always better. This is perhaps one of the most pervasive and frankly most damaging myths out there. It suggests that a man's size in this very specific area dictates his masculinity and his ability to satisfy a partner. Many men worry constantly about this, feeling inadequate if they don't believe they measure up to some impossible standard. But let's look at the facts, shall we? A study from UCLA back in 2013, which surveyed over 26,000 women, found that a mere 14% considered penis size a significant factor in their intimate satisfaction. Think about that. 14%. What did the other 85% say? They reported being completely satisfied with their partner's size, regardless of the measurements. So what does matter to women? The study clearly showed that emotional connection was paramount, followed by technique and attentiveness to their partner's needs. Size actually came in 7th place, trailing behind things like good hygiene, clear communication, and foreplay skills. From an anatomical perspective, meaning how our bodies are built, the most sensitive area of the vagina is actually within the first couple of inches. Any normally developed penis can effectively stimulate this area. The average vaginal depth when aroused is also quite modest, only about 3 to 4 inches, designed to expand comfortably for whatever enters it. Globally, medical data indicates that the average erect penis length is around 5.16 inches, with 96% of men falling between 4 and 6.3 inches. Yet so many men believe they are below average because they compare themselves to what they see in adult entertainment, which, by the way, often deliberately features men with unusually large penises and uses camera angles to make them appear even bigger. The liberating truth here, my friends, is this: technique trumps size every single time. Emotional connection is far more important for sexual satisfaction than any physical attribute, and confidence, along with genuine attention to your partner's needs, matters infinitely more than mere measurements, so please let go of this burden. Myth number 2, erections must be instant and constant. Now, this is another dangerous myth, especially for our younger men, but it can affect anyone. It's the idea that a real man is always ready for intimacy, that an erection should appear in seconds, last for hours, and that any delay or loss of an erection during intimate moments is a complete failure. This belief is truly damaging, fueling what we call performance anxiety, which can actually cause the very problems men fear most. Let's talk about physiology, meaning how your body naturally works. The normal time it takes to achieve an erection varies considerably based on your age, stress levels, fatigue, and overall health. For a man in his 20s, 30 seconds to 2 minutes is perfectly normal. For a man in his 30s, it might be 1 to 3 minutes. And for those of us over 40, 2 to 5 minutes is entirely within the realm of normal. Many factors influence the quality and timing of an erection. Stress, for example, can reduce erection quality by a significant 40 to 60%. Not getting enough sleep can decrease function by 25%. Even a little bit of alcohol can double or triple response time. And it's important to remember that common medications for depression, high blood pressure, and allergies can affect erectile function in about 78% of men who take them. So if you're on these, it's something to be aware of. Here's something that might surprise you. About 67% of men experience erections that come and go during foreplay and the early stages of intimate activity. This is completely normal. Your body isn't a machine that just switches on and stays on. It's a complex hydraulic system that responds to both physical and psychological signals. The freeing truth here is that variability in erection response is absolutely normal. Quality of the experience matters far more than how quickly it happens. And frankly, open communication with your partner resolves 95% of these worries instantly. Just talk about it. Myth number 3. Frequent ejaculation is always healthy. This next myth is so dangerous that I have literally seen men in the emergency room because of it. We're talking about a habit that 73% of men believe is beneficial for their health, but it could, in some cases, be actively harmful. This myth has even been supported by some doctors in the past, but new research is truly changing everything we thought we knew. This myth states that more ejaculations are always better for prostate health, that men must ejaculate daily to prevent cancer, and that intimate abstinence is harmful. Many men have heard the recommendation of 21 ejaculations per month and interpret this to mean daily self-stimulation is medically necessary. This myth stems from a misinterpretation of legitimate research. The famous Harvard study did show a correlation between ejaculation frequency and a reduced risk of prostate cancer. However, correlation does not mean causation. Just because two things happen together doesn't mean one causes the other. More importantly, that study didn't distinguish between partnered intimacy and self-pleasure, nor did it consider the quality and method of ejaculation. Recent research from 2023 to 2024 reveals a much more nuanced picture. While a moderate frequency of ejaculation, say 3 to 4 times a week, does appear to be beneficial, daily ejaculation can actually harm sperm quality and overall intimate health. Daily ejaculation can reduce sperm concentration by 35% and decrease sperm motility, and it can even lead to zinc depletion and other nutritional deficiencies over time. The key distinction here is between partnered intimacy and self-pleasure, particularly self-pleasure combined with adult content. Partnered intimacy offers hormonal benefits, stress reduction, and an emotional bond that self-pleasure simply cannot replicate. Excessive self-pleasure, especially with adult content, can increase cortisol levels, potentially create addiction-like behaviors, and can even reduce sensitivity to partnered stimulation. The most dangerous aspect of this myth is when men force themselves to ejaculate daily for health reasons, even when they don't feel a natural desire. This can lead to intimate experiences that feel mechanical and joyless, and a potential aversion to intimate activity. On the flip side, some men embrace retention movements, advocating total abstinence for months, which can cause prostatitis, inflammation of the prostate, psychological distress, and obsessive behaviours around intimate health. The truth, my dear friends, is that the optimal frequency of ejaculation is highly individual, generally 2 to 7 times per week, depending on your age, health, and natural libido. Your body's natural desires are often the best guide. The quality of the intimate experience matters more than the quantity, and maintaining a healthy balance between partnered intimacy and self-pleasure is crucial for overall intimate health. Myth number 4, pain and discomfort are normal. This fourth dangerous myth is one that literally stops men from getting life-saving care. It's the belief that men should just tough out pain and discomfort in their genital area, that seeking medical help for intimate problems is somehow unmanly, and that if you can tolerate the symptoms, they can't be serious. This myth, I'm telling you, leads to delayed diagnoses of serious illnesses and turns minor issues into major health crises. Any pain, discomfort, or unusual sensation in your genital area absolutely warrants medical attention. I cannot stress this enough. 97% of serious urological conditions, meaning conditions affecting the urinary and reproductive systems, start with symptoms that seem minor or intermittent. Early medical intervention prevents 85% of serious complications. Let me give you some specific symptoms that require immediate medical evaluation. Pain during urination, also known as dysuria, a burning or itching sensation, unusual discharge, pain during an erection, changes in the colour or shape of the penis, any lumps or swelling in the testicles or penis, and persistent changes in urination patterns. The consequences of ignoring these symptoms can be severe. For example, a delay in diagnosing testicular cancer, which often presents as a painless lump, can mean the difference between a 95% survival rate with early detection and a significantly lower rate if it has spread. Similarly, ignoring symptoms of a urinary tract infection, UTI, or prostatitis can lead to chronic pain, damage to the kidneys, and even sepsis, a life-threatening bloodstream infection. Many men also suffer in silence from conditions like Peyronie's disease, a curvature of the penis caused by scar tissue, or chronic epididymitis, inflammation of the tube that stores sperm. These conditions are often treatable, especially with early intervention, but the myth that pain is normal prevents men from seeking the help they need, leading to unnecessary suffering and long-term complications. The liberating truth here is that pain and discomfort are your body's way of telling you something is wrong, and you should always listen. Seeking medical help for intimate health concerns is a sign of strength and self-respect, not weakness. Early detection and treatment are crucial for preventing serious health problems and maintaining your quality of life. Please, do not hesitate to talk to your doctor about any concerns you have, no matter how minor they may seem. Myth number 5, age means the end of intimacy. Finally, we come to a myth that I hear far too often in my practice, and it sadifies me every time. It's the belief that as men age, their intimate lives are naturally over, that a decline in function is inevitable and untreatable, and that older men simply lose all interest in intimacy. This myth is not only untrue, but it also robs countless men and their partners of fulfilling intimate relationships in their later years. While it is true that there are natural physiological changes that occur with age, such as a decrease in testosterone levels and changes in blood flow, these do not automatically mean the end of intimacy. Medical advancements have provided numerous effective treatments for age-related intimate health issues, and many older men continue to enjoy active and satisfying intimate lives. Let's look at some facts. Studies show that a significant percentage of men over 60 continue to be sexually active. AARP surveys have consistently found that intimacy remains important to the majority of older adults. While the frequency and nature of intimate activity may change with age, the desire and capacity for connection often remain. Age-related erectile dysfunction, ED, for example, is often treatable. Medications like Viagra, Cialis, and Levitra have revolutionized the treatment of ED, allowing many men to regain function. Other options include vacuum devices, penile implants, and lifestyle changes such as exercise, weight loss, and quitting smoking, all of which can improve blood flow and overall intimate health. Furthermore, intimacy is not solely defined by intercourse. As men age, they and their partners often discover new ways to express affection and connect intimately, focusing more on foreplay, touch, and emotional closeness. The emphasis often shifts from performance to shared pleasure and connection. The freeing truth here is that age does not have to mean the end of intimacy. While there may be challenges, there are also numerous solutions and ways to adapt. Maintaining open communication with your partner and your doctor is key. With the right information, medical support, and a willingness to explore new possibilities, men can continue to enjoy fulfilling, intimate lives well into old age. There you have it, my friends. 5 major myths about men's intimate health, debunked, with facts and a good dose of common sense. I hope this conversation has been helpful, perhaps even a little bit liberating. Remember, your health is your most valuable asset, and that includes your intimate health. Don't let outdated beliefs or misinformation stand in the way of seeking the care and information you need. If you have questions or topics you'd like me to cover in future videos, please leave them in the comments below. I love hearing from you and addressing the issues that matter most to this wonderful community. Until next time, take care of yourselves, listen to your bodies, and keep those conversations about health open and honest. This is Dr. Talia Amara, signing off. See you soon.